some blood from this patient for PRF, platelet-rich fibrin application. We're going to use the Vacuette to draw blood directly from the vein. First thing we're going to do is we're going to put on a tourniquet. We're going to have the patient lift up their arm. I like to lay it on the inside. I like to pull tight like this so that way it's not pinching the patient's skin. I like to then overlap. I like to pinch and then roll this underneath like so the tourniquet's on. I'm going to have the patient open and close her hand slowly. Open all the way, close all the way, open all the way, close all the way. I'm going to stand in this position. As you can see, the patient has good arm support so the patient doesn't move their arm and it's got good stability. I'm going to have the patient hold a nice tight fist. I'm going to do a little tapping on the arm to see if we can find the best vein in the area, like so. And the patient has a decent vein right here, also from the antecubital fossa. And here, we're going to take a alcohol pad and we're going to go ahead and cleanse these areas. And as the tourniquet stays on longer, you will see veins that pop out much better. And here, look at this beautiful one. So we're going to rotate the arm a little further, and that's where we're going to draw blood from directly. We're not starting the catheter. This is going to be a direct puncture into the vein for a blood draw. This here is the Vacuette container. When you insert this, you want to have the bevel up, and you're going to support this, and then you're going to hold this in position once it's in the vein, and then we're going to put the tube in directly. This is the tube that we're going to use, the actual vacutainer. So once we're into the vein, we're going to support, we're going to go in and draw blood. I'm going to hand that back to my assistant. Patient's holding a nice tight fist. I'm going to tap again like so. I'm going to rotate this a little bit. I'm going to palpate where the vein is. Patient's veins are good. We're going to go ahead and insert this into the vein. Just like so. Nice little retraction with the thumb on the opposite side to hold the skin taut so that way it doesn't move. We're going to go ahead and insert into the vein like so, a little pinch, puncture. You see the flashback actually inside here, but this is a rigid needle, so if you move, it can puncture through the vein, so it's good to support. My hand and my fingers are resting on the patient's arm. I'm going to take the tube as I'm supporting here. I'm going to push the tube in like so, and you will see it fill with blood. We're going to let this fill all the way in. So this is a direct puncture directly into the vein for a blood draw. The disadvantage with this technique is that there's not a catheter that's left in for you to administer medicines and for additional blood draws if you need them. But for a simple draw, this is adequate. Now, when I remove this tube, I'm going to support this so the Vacuette does not come out. We're going to remove the tube. I'm going to hand this to my assistant. I'm going to take a piece of gauze with some tape. We're going to lay this over where the needle is at. I'm going to press down. I'm going to pull the needle out. I'm going to flip this up, secure the needle. We're going to remove the tourniquet. And then we're going to go ahead and put this on the patient's arm over that area. I'm going to push down with pressure, remove the tourniquet. We're going to lift the patient's arm up just like so.